Hi, my name is Jacey, and my intervention is about a mobile health clinic that is partnered with Straub. The purpose of this grant proposal is to create a mobile health clinic with cancer preventative screening services to specifically help the communities on the west side of Oahu. The mobile health clinic will operate on weekends at designated locations so that patients are free and don't have to worry about missing work, as well as the qualified staff of physician, nurses, and medical assistants. They will then service the patients with the cancer preventative screening tests. The mobile clinic will be in partnership with Hawaii Pacific Health, specifically Straub. This is a beneficial collaboration because of the large outreach they already have established with the targeted populations, as well as with the whole island of Oahu. They also have previous experience with a mobile vaccine clinic called the Vac Squad Bus during the COVID-19 pandemic. The amount of funding requested is $144,000 for payroll of staffing, fuel for traveling, materials, and office supplies. In my research, I have found that Native Hawaiians and Pacific Islanders always had an unstable relationship with health and prosperous life expectancy, and they continue to die at younger ages than other ethnicity groups in Hawaii. Data on chronic morbidity show that over the past 3 decades, Native Hawaiians have experienced higher rates of chronic illness than have other groups. Cancer has been the leading cause of death among Asian Americans, Native Hawaiians, and Pacific Islanders since 2000. They also struggle with access to healthcare, and it is so essential because it ensures services that are used to prevent, detect, and treat illnesses. Nonetheless, it is vital for everyone's health, well-being, and their overall health outcome. Not everyone is able to obtain equal access to healthcare though, and that is due to a lack of health insurance. Among Native Hawaiians in Hawaii, 8% were uninsured and 16% had no regular source of medical care. Uninsured Native Hawaiians and other Pacific Islanders are 40.9% significantly less likely to obtain an annual checkup. Access also includes transportation to and from clinics, hospitals, and appointments, and depending on neighborhood location, access to a vehicle and accessibility to the bus or the handy van. Transportation can be a barrier of getting necessary healthcare services. When populations are unable to access these health services like checkups or screening tests, they are more prevalent to developing ailments that can worsen rapidly to chronic illnesses if not caught early on or at all. And so that leads me to the importance of preventative health screenings. It is crucial to take part in cancer prevention as much as one can because of how important early detection is and the ability it has to save lives. Given the multiple benefits of cancer screenings in early detection and diagnosis, reduce cancer mortality, and reduce disparities in cancer, screenings are an important strategy to help improve overall population health. The target population are adults ages 18 and older living on the west side of Oahu. This population is getting targeted because the adults living in West Oahu are mostly made up of Native Hawaiians and Pacific Islanders. Native Hawaiians not only have the poorest health status in the state, but in the nation compared to all ethnic groups. They have unproportionately high rates of cardiovascular diseases, cancers, diabetes, and many other chronic illnesses. Native Hawaiians and Pacific Islanders have lower preventative medicine practices, greater difficulty in obtaining healthcare for themselves, and because of this, they have a lower life expectancy overall. It is most notable to consider that the mobile clinic be driven into priority location hotspots to help people in the communities that need it most. In an article emphasizing neighborhood level hotspots using a university student run mobile clinic, it says, bringing the mobile clinic directly to neighborhoods diminishes the transportation barrier many patients face. At some clinic locations, the percentage of patients who walk to the bus is as high as 75%. These uninsured patients without transportation are no longer isolated from access to healthcare services. The short-term goals of my intervention are to get people on the west side screened more frequently, help them with easier transportation access to preventative screening services, and overall get people to take better care of their health. Community change will be determined by how much the mobile health clinic has outreach to people on the west side through improvement in healthcare and transportation access and decreased cancer morbidity in Native Hawaiians and Pacific Islanders. The long-term goals are to lessen the gap between Native Hawaiians and their health to the rest of the ethnic groups. The entire problem may never completely be solved, but with a mobile clinic, it is possible to greatly improve it. Mobile health clinics have the potential to offer many benefits to the healthcare world and to the overall well-being of the public's health. It is only a matter of how we can utilize that concept here and help our own people of Hawaii. Thank you.